All right, well, hi everybody and welcome. We're really excited to have you with us today. My name is Holly Gerslin. I work for the University of Texas at Austin. We're excited to know that we have folks from all over the US joining us today for this particular training. So we're excited to hear from you. Feel free to put your name and where you are from in the chat to say hello. If you are here for the mental and behavioral health monitoring and early childhood intervention, support for the use of the SWYC and the MCHAT, otherwise known as Modified Checklist for Autism in Toddlers, then you are in the right place. I'm going to go over a few logistical things with you, and then we're going to jump right in because there's so much good content to share with you. First and foremost, we do need to acknowledge that this particular training was set up for you through the Mental Health Technology Transfer Center network under an agreement with the Substance Abuse and Mental Health Services Administration, otherwise known as SAMHSA. The opinions expressed in this presentation are the views of myself and the speakers and do not reflect the official positions of the Department of Health and Human Services, or UT. That includes trade names, commercial practices, or organizations. So our entity does have a code of conduct for our learning spaces that we like to share with all of our participants ahead of time. Please feel free to just read through this. But the idea is that we like to create safe, equitable, and open spaces for folks to learn, and we respect that process. We are open to all wonderful and great questions, and we encourage you all to learn from each other as well. All right, it's now my honor to introduce you to our presenter today, Meredith Brinster, PhD. Let's present you. She has focused her research and clinical work on increasing access to care for autistic children and their families, with a special emphasis on supporting families through the lengthy diagnostic odyssey. She has over 15 years of experience and has partnered with Sherry Ravenscroft, MD, the section chief in departmental behavioral pediatrics, to together develop the Comprehensive Autism Program, otherwise known as CAP. The novel program developments have dramatically reduced waitlists to obtain early autism diagnoses. She's also developed numerous programs to further support primary care physicians and reduce waitlists for school-age children. And she maintains a passion for empowering families through the diagnostic process and to develop programs to help families post-diagnosis process as well. So we're very excited to have Meredith Brinster with us today. I am going to stop my share here and pass the baton to you, Meredith.
All righty. Thank you so much for that introduction there. Can everyone see and hear me all right? Okay, wonderful. So this is going to be a pretty hands-on, practical walkthrough of the use of these tools, and we can certainly open up broader questions for whatever really throughout. It may be most helpful to put your questions in the chat. Unless there's something pressing that feels like it would be really important to ask at that time. Specifically, if there's like a technical question as we walk through, for some of these tools, we'll walk through administration scoring and certain details like that. If you feel like it would be helpful to clarify, or if I'm unclear at some point, and maybe there's that would be helpful before we keep moving on. Please feel free to jump in. I don't mind being interrupted. We can pivot that way. And so these are the two tools we'll be looking at. The Survey of Wellbeing of Young Children, which is, as we'll see, is a pretty broadband screening tool for many areas of development, including sort of more specific family concerns. And then, of course, the ever popular Modified Checklist for Autism in Toddlers, including sort of the follow-up process with that, which is typically, I think, the area of most confusion. So we'll definitely take some time to walk through that process. And let me make sure this is going to work for me to keep going. Okay, just quickly, of course, I'm affiliated with Dell Medical School in Psychiatry and Behavioral Sciences. Holly mentioned being part of our comprehensive autism program. I'm also part of our ACT-LEND training program. So I do a lot of advocacy and training for family self-advocates and students who have a particular interest in neurodevelopmental disabilities. I've been on the board for the Autism Society of Texas, and just some of my affiliations there. But let's jump right into an overview and some of the objectives we have for today. So first, I definitely want to just walk us through what is, the utility of and some of the ways of using what we would consider a level 1 screening tool. Both of the measures we're going to talk about today are considered level 1 screening. So I think it's good to have a foundation of, how those should be used, how to interpret those, and how to communicate those things with families. And then we will absolutely walk through each of these tools in a way that is hopefully very helpful for you all to not only learn about today, but as these slides will be available later. Hopefully this will be something you can reference as you as you use the tools to go back to and make sure that you're administering appropriately and interpreting. And so we'll spend a little bit of time talking about best practices for communicating results. That might be an area where we wind up having some discussion and ask some questions about that, or people can share their experiences, pluses or minuses with that. And maybe as a group, we can kind of just share and problem solve. Definitely talk as best I can about referral recommendations from a broad standpoint, knowing that this is a very broad audience. And then lastly, I'll have some additional resources for you all to continue your education in these areas, or reference back to some other materials that may be just as helpful for you to continue to learn about these tools and use them. All right, so let's jump into developmental screening tools. So sorry about the lengthy, wordy slide here, but this is important for us to walk through, just so everyone has an understanding about what a screening tool is, what it's not, and essentially what we're doing with screening tools is throwing a wide net, if you could imagine, into like a big pool of water and trying to grab anybody who might be at risk for any kind of developmental delay or disorder. Of course, autism being one of those in our early childhood population. But because of this, they're often used in large scale. The tools we're going to be talking about today are freely available. Some of them can be general, as we talk about lots of different areas of development, or they can be, specific to language, to cognitive development, gross motor, or like we said, autism. They are designed to be as brief as possible, so that it can be, easily utilized and scored and get some information quickly. But what they do not do is provide a diagnosis. This is sort of a first sweep to try to grab as many kids that may have a concern, and of course then know sort of the right triage process, where to send a child next, when to monitor, or when to just sort of give the family reassurance that their child is on track in various areas of development. If a level 1 screener identifies a problem or an area of concern or be considered at risk, they may be referred for further evaluation, and we'll talk about some of those, but certainly sometimes developmental pediatricians or psychologists like myself, or teams of us, can be helpful there. One thing to note is that, screening tools are sometimes just referred to as screening. You don't always hear level 1 versus level 2. There are level 2 screeners out there. I don't know them as being as commonly used. I did a little digging, and there may be like 4 out there. There was a meta-analysis research-wise, but they are not ones that I'm super familiar with, or readily use. I think that can be another step, perhaps, but most of the time when we're talking about screening tools, we are talking about level 1, and we're not necessarily distinguishing between the two. Let's see. The biggest thing to take away from this and thinking about the interpretation of an elevated score is that screening tools are designed to be what we call more sensitive than specific. So what we're talking about is that we might capture many more kids who are considered at risk but do not actually have a concern for autism or any other developmental delay. So when we capture those, we kind of talk about them as being false positives. So they may have some elevated concern, but then they wind up being okay. And that is because the flip side of that is that we'd rather risk grabbing kids with any possibility of being delayed or having some sort of need for intervention, rather than sacrificing the ones who are truly needing some supports, but maybe being missed because we were being too specific with our tool. When we talk about being specific, we're really leaning in towards more of those diagnostic tools at that point, kind of fine-tuning things. So screenings are helpful in the way that they're brief, and we really get a quick snapshot, hopefully, of is there a possible concern here? So that will be what we're talking about today. So let's jump into our first one. I decided to start with the survey of well-being of young children. It's going to be a little bit lengthier because there's just many more components to it. It is the measure that is trying to capture as many different areas of development as might be applicable to young children and early childhood family concerns. So we'll start there, and then we'll get a little more specific with the MCHAT later on. Just some quick facts about the SWYC here, which I'll refer to it by that name from here on out. As I mentioned, it's freely available. It's targeted for children 5 years and under. It is about 15 minutes to complete at each point, which seems to me a little bit unique given all these areas that it's intended for, but there is a little bit of a breakdown of which pieces are included per the age range. And then, as I mentioned, it's a comprehensive screening instrument in that it's looking at a lot of areas of development. So we're going to talk about all the different areas of development in terms of the milestones. When we think about milestones, we're thinking about language, gross and fine motor, cognitive development, and adaptive skills, typically. The parents' observation of social interactions is going to be a unique add-on that the SWYC has that somewhat mirrors the MCHAT and is a unique option as part of this broader system here. Then we have the preschool and then the baby pediatric symptom checklist. So there's sort of different age ranges there when we're thinking about more problematic behaviors. We'll get into that, things that might be more indicative of attention problems, internalizing, externalizing, temperament for the younger ones. We'll talk about that. And then the parents' concerns and just family questions generally is a nice overview that can help guide follow-up questions. So we'll walk through all of this. So let's start then with the milestones here. What's nice about this is that at any given age point, as you can see, there's many of them available on the right side there, that there are targeted questions, only 10 questions at each of these ages that a parent would fill in. So in that way, it's very brief, a real quick look at how is your child doing across the various areas of milestones that are pretty important at that particular time. So not every one of these is going to cover all of the developmental areas, but it's really going to focus on, with those 10 questions, which things are most important at this point of development when we're 4 months of age, 12 months of age, 18 months of age. What types of things do we want to flag for as potentially delayed, or are we going to reassure them that they're right on track? One thing to note too is that the test designers suggest that the highest and the lowest range of ages there, right at 2 months, and at the 60 months when we're really looking at like a 5-year-old, they're not as well validated at that point. And the good news is 2 months of age is pretty young. Maybe we're still given a lot of time for development to continue. And at 60 months, there's a lot of other tools and ways that kids are being tracked in their development. So not a huge concern, I would say, for those age ranges. The only other thing to note, and this is part of the frequently asked questions and some of the things that come up for the SWYC, is that they suggest if the child is under 2 years of age and 3 or more weeks premature, you would adjust for that prematurity as you interpret this. And we could talk about this later if there's a question of kind of what that means. But essentially, what we don't want to do is expect a child who was born significantly premature to be hitting certain milestones based off their age. Rather, they kind of have a little bit of catch up for development in that way. And that's a common practice in these tools when we measure development and milestones. Let's see. So I thought it would be most helpful just to give you all a look at some of the big hitter milestone checklists for different ages. So starting at about 6 months, as you can see, there's questions about language. Are we starting to babble? Are they looking at you when you call their name? Of course, that can touch on their hearing, but also things that we're looking for when we're tracking for social communication challenges. Are we rolling over? Gross motor, are they passing toys from one hand to another? Then we've got a fine motor skill there. Do they look for, it's a lot of different areas, which is really nice. And then folks can answer, yeah, not at all, not yet, or maybe we've got an emerging skill and it's somewhat happening, or sometimes, and then very much like this is a consistent skill that they're demonstrating here. And just kind of walking through 10 months when we're really starting to think about getting closer to using our first words, moving around, possibly being mobile and walking by this point. And then maybe, following some simple commands. These are the sorts of things that we would be looking at 12 months. And another big one, 18 months, just kind of looking at, are we combining words by this point? Are we continuing to progress with our gross motor skills? From a receptive language standpoint, can they identify certain body parts? Are we using words like me or mine, some of those pronouns that we want to see emerging at that point? 36 months, we're gonna jump ahead there, but really when we're thinking about a 3-year-old, asking questions now, those WH questions, are they able to kind of tell you a little brief story? Are we drawing simple shapes? Do they understand concepts like yesterday or tomorrow? And also from a speech and communication standpoint, kind of checking that box of your articulation there. So are they able to be understood by others most of the time? And so I don't want to jump too far ahead of that. If anybody has any questions regarding that there is, we will talk about scoring, about cutoffs for that sort of thing as well. And so that is all the instructions about what would be considered an elevated score in various areas is sort of what's going to guide you as to talk about these things. If there are milestones that a child is maybe not hitting, it could be a flag at that point, just on those developmental milestones. More what we're thinking about for something like early intervention. So if there isn't a strong concern for speech or language development, that might prompt the PCP or an early childhood provider, anyone who's interfacing with this family, to encourage them to be evaluated by their local early childhood intervention or early intervention program. So the biggest ones we can think of would be about, recommendations to be evaluated for possible speech therapy, maybe occupational therapy when we're thinking about those fine motor skills, or even physical therapy for gross motor skills. When we start to think a little bit more about these social interactions, as I had mentioned, the component of the SWYC that they have here is they have 7 questions to address potential risk for autism spectrum disorders. They are automatically included on the back of the SWYC form at these particular age points. So what's lovely about this is you don't necessarily have to get a child's age and walk through and say, which extra form do I need? They are automatically included at the different time points for various things that would be applicable. What's that?
That might have been an accident, Meredith. Keep going.
Oh, okay. And so that at the 18, 24, and 30-month age ranges, which is pretty consistent with the MCHAT. The MCHAT, as we'll get to, is recommended at 18 and 24. And both are, and this one is actually validated between 16 to 36 months of age. So you could feasibly give this to a child between those ages. These are the recommended age points to administer, obviously lining up with their well child checks. But it's important to know that any child between the age of 16 to 36 months, let's say you interface with this child and it's not in the context of a well child check, or it's not at that time point, that's okay. You can still actually administer this piece of it and get a sense of risk for a child. This is what that form looks like. So right at the 18 months, and I would say this is where the trickiest component comes in for this particular rating scale, because the first 2 columns, even though there's kind of a separate set of types of questions here, there's the Likert scale at the top going from, many times a day to never or always never. There's a lot of differences here. Really what they're suggesting is that anything on those 2 left columns would be given a score of 0. At the top, really what we're looking for is positive social behaviors would get a score of 0. These are the things that we would want a child to do. We want them to be using words. We want them to be pointing with their index finger. We want them to be playing with dolls and stuffed animals to demonstrate some of that emerging creative or more pretend play. And then, of course, are they interested with other kids, things like that. If we're seeing some of these behaviors happening less from that social standpoint, whether it's a sometimes or only a few times a week, all the way up to never, this is where you're going to get 1 point for any of these. And just to note, if sometimes parents fill in, as they might, because it might not feel completely clear to them, if they say few times a week or less than once a week, because maybe it's not consistent, they recommend that you consider the more concerning one. Or if somehow they do a few times a day, they span the green side that I have here to the red side. As we're thinking about screenings, you're going to err on the side of being more conservative, more concerned potentially. So you're going to take that higher rated score. You're going to give a 1 over a 0 if there's some distinction between the two. And then if there was 3 or more of these indicated as in the red zone here, then this would suggest an elevated concern for autism. So if they're lining up their toys, and then they're not communicating, or they're, screaming and crying when they're trying to communicate what they can do, and they're also not very interested in other kids, that would kind of give us that 3 that we're looking for. It could be higher, of course, as you go through these, but just 3 of those would be enough to kind of flag that and maybe start to think about following up on some of these things and maybe making a referral. So as you can see, the brevity of this, it's quick, it's easy. The scoring, like I said, not so easy unless you've got these beautiful little boxes there and all the codes and whatnot. So that's why I'd like this to be readily available to you. So hopefully this sort of reference will be helpful to feel like you could administer and score this quickly to get some information. Let's see. Now
it looks like I have one
go ahead.
question.
Yes.
Go ahead, Yvette.
So, and we give to the parents, or we fill it out? Sorry, Yvette.
Oh, so sorry. Yes, these are,
Can you
I'm
hear
so
me?
sorry, that was a big oversight. These are caregiver responses, right? So they would read it and they would fill this in. I recommend, it depends on how you can do it, but typically when I use a screening tool, I might hand it to the parents. They can do it in the waiting room. They could do it with, just to kind of be timely. But then a lot of times when I receive it back, I want to look it over, make sure there's no missing items. Maybe if they are double scored, you can have a little conversation to help you decide which one is the most appropriate response. And then also just check in and say, were there any items that were confusing or maybe you didn't understand? So I like to do that check. You could always administer any of these things in sort of a semi-structured interview where you would read it to them, but a lot of times it's quicker and easier for them to just read it themselves. Of course, from a cultural standpoint, if there's anybody who does not feel comfortable reading this, or this is not their native language, and this is actually available, we'll talk about this in many, many languages. So translating it, or if there's any concern about comprehension, you can kind of just use your clinical judgment to help them complete this form. It might take a little time, but then you're going to get some accurate information. But
I'm sorry.
Go
So
ahead.
coming from a child care area, and so what the issue that we have is, first, it's getting the parents to take this seriously. Like, after there's something that, we've had several more in the past few years with autism. And the thing is, what we have found is it's been very difficult for the physicians to do anything about it, because we get the same answer all the time. Oh, well, they said, wait till he's a little bit older, wait till the child's older, and then they'll do what I feel they should be doing at an early age, early intervention versus big. But they all keep saying, well, especially for boys are delayed, so we have to wait till they're a little bit older. But you can clearly see the lining up or running around or the scream, the
Mm-hmm.
sensitive,
Mm-hmm.
you see all, and we see it. And so it's almost like, okay, well, we can't do anything because they took them to the doctor, they've taken them to the doctor, and they say, wait. And in the meantime, our classes are so disruptive, or we're having to pull people. What is the best way, I guess, to get to the physician to understand that this is, serious? It's an issue.
Sometimes it's a tool just like this, I would say. I think that's sort of, me being an assessment person. I know it's, these are sort of time, they can be timely, they can be a bit arduous to do, but I love having the numbers just to be, if you could convince the parent to say, well, look, there are some tools out there. These are screening tools. This is something that's not going to be diagnostic. It's not going to suggest one way or the other, but it could be something that you could present to your PCP to have them take this more seriously. And then, of course, letting them know that the PCP is not the only way that they could potentially get on the wait list or go to see a specialist for this. So you can empower the family there that, at least in our clinic as well, eventually we do request that the PCP send a referral, but that's sort of a back office insurance purpose. But that doesn't mean that families can't call us. So if you all have a list of resources for your local specialists who could do developmental evaluations, I would not hesitate to make sure parents feel empowered to do that if they themselves have concerns, or if they are taking your concerns seriously. We wish, of course, that the PCPs would be just as willing or not necessarily holding off. But unfortunately, the scenario you're describing is something we hear a lot, and parents are frustrated, and they really have to have that sort of advocacy and pushing and continuing to be a squeaky wheel for their kids. And we really commend parents when they do that. But I think what you're describing is potentially a position to support them and to help them advocate, and just to know that, they would at least have a piece of paper, or they would have a document, or they would have something like this that's been validated that does suggest, this could be something to be concerned about. Not just your observations, right? It's kind of putting your observations or their observations onto on a piece of paper that validates that. Does that help?
Yes.
Okay, wonderful. Okay. So that is this particular tool here. It does sound like a lot of what we probably see early on is concern for autism, or just general speech delays, plus or minus one. They can be combined, obviously.
And Meredith, I actually have another question if you have time.
Sure.
Leslie?
Hi, real quick. I work in a child care program as family support director, and we already do the ASQs. We support the teachers. We send one home with the parents, and then we support our teachers and also doing one, and we kind of combine to have the conversation at like parent teacher conferences, or as Yvette was saying, like when there is a concern. Would you recommend, or would it be okay to either you use this alongside, or use the ASQ, or just this one?
I think it's either or. They're very similar in the way that they are looking broadly at development, and I believe that the ASQ, if you're also using that social emotional carve out, that is sort of the complement to this here. So I don't think there's necessarily a reason to do one over the other. It's good to know what's out there. I think it's whatever is readily available, and I know a lot of primary care groups will use the ASQ. So I don't necessarily think you have to do one over the other. If you have something that's got some sort of cutoff that helps you have that conversation, I wouldn't necessarily push one or the other. And I think that's wonderful that you guys are already doing this.
Yeah, it's an inclusive program, but as we know, over the last several years, we have a higher incidence of developmental delays. So we're trying to arm parents with something to take when we refer them over to the pediatrician or a specialist that we are observing. So I just wanted to make sure that it wasn't a lot to do if we did both or something, or the MCHAT and the ASQ.
I mean, you could, but I do think that would be that would probably be more effort than you need. I think either or, they're similar tools. I know the SWYC has done a lot of work to kind of sort of check in whether or not it's consistent with the ASQ, and it's been built off of lots of other tools. So it's whatever's more comfortable for you, whatever's easiest for the family. But yeah, just know when we talk about screenings and things like that, or any kind of tests, even diagnostic tests, there's multiple out there. It could be a preference, whatever you like. And sometimes over time of using one or the other, you might come to prefer one for various reasons. Sometimes they're a little more user friendly, or they're a little easier to score. It's whichever. Just know that those are very similar, the ASQ and the SWYC.
Okay, thank you.
Sure. I think there's another question too, actually.
Yep, Vanessa?
Good afternoon, everyone. I'm dealing with this with my granddaughter, and she's 3. But my daughter says that her pediatrician will not do the testing, what you was talking about, like did she reach her milestones until she turns 5? Is that the case, or?
No, it's a great question. And I think both your gut and what we're talking about today are suggesting that when we're talking about developmental screenings, we really are saying like 0 to 5. So 5 would be, sort of the last point to look at some of these things. So I would encourage you or your daughter these are free forms that you can access. To fill these in and either bring it somewhere, or even just press for, at this point, your local early childhood program or early childhood intervention would be able to do an evaluation. And even at the age of 3, the local school district should be able to do that. So there's options. If the PCP is not necessarily validating some of those concerns and telling her to wait, I would go the route of some of those other programs, like the early childhood special education, to have them evaluate, see if she would qualify, especially if she's already 3.
So where do I get the forms from? Do we get it from the baby's pediatrician?
I would look up, I don't know where you're located,
Okay.
but your local.
I'm in Augusta, Georgia.
Okay.
Georgia.
Okay, well, the local school district there, if you looked up, if you, depending on what your public school, your school district is where you start, and then you would look how to request an evaluation for her from that website.
Okay, thank you.
Sure, absolutely.
And Vanessa, I don't know if it helps here, but you can also, I've put a link into the chat. If you want to even take a screenshot of it, you can go and find the different tools and print one off and kind of do it in-house and bring it with you to the pediatrician and say, I want to talk about this. So that might be to do it.
Okay, thank you so much.
Sure, absolutely. Okay, let's see. I'm glad we jumped in with those questions that were very applicable to this particular topic. As part of the SWYC, one of the other areas is this preschool pediatric symptom checklist. This is looking more specifically at the age ranges from 24 months to 60 months. So on that big milestones list that I had, this would include all of those from 24 to 60. So we're talking 24 months, 30, 36, all the way up to 60 months. Again, aligning with that well child check or any version of applying this to a child who's around those ages. This is really designed to, as it's called, symptom checklist, where they've done a lot of research to suggest that the items that they included in this would flag for what we call internalizing behaviors. And when we think about that, we think about some anxiety or sadness or something that, you can see a child being a little more withdrawn, or maybe even having some physical symptoms that are in response to maybe some worries or things, stomach aches, headaches, things like that. And so that is a potential group of symptoms. The externalizing, of course, is what it sounds like, which is we may see some aggression, some hyperactivity, some difficulty controlling their body, maybe some impulsiveness. And that can be, something that is problematic in settings. The internalizing tends to be a little less obvious, but no less, problematic for a child. But the externalizing are typically things we see and maybe are get a bit of attention and red flags towards them, more disruptive in settings. Then there's a whole host of questions that would really touch on attention problems. This may be, difficulty following directions, difficulties, maintaining attention to a brief task like coloring or some sort of arts and crafts. And then also, as parents are the ones filling this in, they're able to also just sort of validate their side of this would be maybe parenting challenges that they're having as related to some of these items here. So this is really kind of flagging some more problematic behaviors as we're getting a little bit older and we're starting to think about sort of mental and behavioral health for kids. Less so just the kind of developmental milestones, but flagging for anything that's going to be, a little more concerning from kind of their, just kind of overall well-being and behavior. And so this one, of course, all of these are going to be scored differently. So this is why I really tried to break it down as best I could for these things. And so they would fill in all these items here, just in line with the actual numbers there. If you're not seeing anything at all, that totals 0. You would add up all the ones that maybe are happening somewhat or sometimes, and then you get a two pointer if this is happening very, very often. Any missing items for all of these are always going to be scored as a 0. And again, if there's a double code for any particular item, you always lean towards the higher rating, just to be as inclusive as we can. And then when you were to total all of these, if there's 9 or more as your total score, then this might be that you're identifying that a child is at risk for some of these early social, emotional, behavioral, more mental health concerns. And this may be a flag to make sure we address that, or maybe we have some parenting courses, something like that. So this is a flag that there's a behavioral concern that we want to capture as soon as possible. And let's see, when we look at the baby pediatric symptom checklist, so now we're covering the age ranges from the SWYC that are not covered by the preschool. So now we're starting as young as 2 months all the way up to 18 months. So this is looking a little bit different at things that would be more applicable to these age ranges, but it's still kind of getting at some of these early symptoms that might flag some difficulties with emotion regulation, or just making sure that if we're having a particularly, challenging child, or we've had a little bit of difficulty, we give that parent support at this point, because there may be some tips and tools and tricks that they could really learn from here. So as opposed to those 4 domains that we had before, we're talking a little bit more about things like temperament in this. So there's 3 domains that you might kind of flag really early on between those age ranges of 2 to 18 months, where we're looking for, is there a higher level of irritability, inflexibility, or difficulty with routine? So those are the 3 things that would be appropriate to screen for in this very early age range. It looks very similar, but it's slightly different because now we're, of course, rating the same. You get a 0 score, a 1, or a 2, depending on how often you might see these behaviors. But then each of these different categories gets its own total score. It's not an aggregate score. So let's see this. So we have inflexibility, looks like it's the top one. Hard time being with new people, change, things like that. Next one is the irritability scale, just being difficult to soothe, fussy, crying a lot, difficulty calming down, hard to comfort them. And then the last one is that a difficulty with routines. So each of those would get a score within their own domain, so that you do recognize that any one of these could be a little bit elevated. And so if there's a 3 or more total score for each of those, then that would be the area that would be at risk, and may help you sort of give some resources to a parent, or make sure they're getting support. If we have a particularly fussy child, we want to make sure that the parent has adequate support, or maybe give them some resources for that, because that, of course, we know that can be very challenging. Or maybe if it's difficulty with routine, we give some guidance on how to implement those things. Sleep hygiene, things like that might be some helpful things that might come from this. And so that
Can I ask you a question really quick?
Sure.
You can come back to it if you need to, but just in the chat, it said, and on your last slide, you had an age range of 24 months to 60 months
Uh-huh.
of PTSD. It said they've seen this as low as 18 months old for this tool in the literature, so asking for clarification.
You know, let's see. It was this one, right?
Mhm.
The more I think that is an error on my part.
Okay.
I think it is because I was just realizing when I switched to the other one, I was like, oh, but the other one goes up to 18 months. So what's going on in that range of 6 months? So I apologize. That is correct. You are correct. I need to fix that as a typo there. Thank you for catching that for me. But yes, I was
Thank you.
yeah, thank you. I realized that as well. So essentially just to kind of recap what we've gone through before we move on real fast here to the family and parent concerns is we've walked through milestones, we walked through some just very autism specific questions, and then we walked through some just general sort of behavioral and emotional challenges that could happen in the whole age span and the different tools that they've used as part of the SWYC. So that's something to identify here. So the SWYC is a little bit of a conglomerate of other tools that have already been developed, and they've done the nice work of putting them together and making it easy to hand one sheet of paper at a certain age range that will include all the things that make sense to screen for at that time. Just a bonus of this tool. And then parent concerns and family questions are included on the back of every age form. And it's very brief, two questions that really are there to guide any conversation that needs to be had, and may also be related to the other things that they're filling in. So you can kind of just see the family's perspective on some of these challenges or items that they're endorsing for their child. And just as a note, because I'll show you real quick, these are the two questions broadly. Do you have any concerns about your child's learning or development and behavior? So that's, that's just there. Might even be the first thing you want to look at each time and then say, okay, they do. And then we're going to go back through and say, okay, is it their development? Is it their milestones? Is it their behavior? It's a nice way to enter into that conversation. And again, like I said, these questions are going to be there across the board. One thing to note too, a very nice piece about this, because of course this is the parent concerns, this gives a little bit at their perspective, opens the conversation, but very specifically at the 2, 4, and 6 month forms, circling back here, they do include a very widely used scale for postnatal depression. So that's something that's really nice here. If that's a concern that you have, for the parent, that these are included in those early age ranges for parents to kind of give some information on how their own mental health is doing. So another bonus to that, they've combined a lot of really great things into a system that feels pretty easy to follow along, so long as you know the kid's age range or whatever they're closest to. And another bonus for this tool is that these are all the languages that it's been translated to. Although the website itself says there's some limitations for specific ages. Not every one of these languages has every single age range translated. So I'm assuming that's kind of in the works still, but just something to know. There may be some limitations here, but there is a lot of different languages. When the question came up before about the ASQ, there may be ones the ASQ is translated to that this one's not, and vice versa. So something to consider if you feel like one of the tools has a limitation from a language or cultural standpoint. Okay, since we're kind of running on time here, I want to make sure we get to this one here as this maybe one that people are pretty interested in. So of course, we're talking about the MCHAT revised and the follow-up component to that. I'm not going to tell everyone what autism is for too much. I'll just put it here. You all seem to probably have some really lived experience with kids who have some of these concerns. I trust that you're experts in kind of seeing kids across a lot of environments and have a good sense of what autism might look like. So I'll just leave that there. But to talk it through, again, very similar to the SWYC, it is normed for, or could be used for kids as young as 16 months up to 30 months. So not beyond that. So our 36-month-olds, not so much, but they recommend the screening that this occurs at 18 and 24 months well child checks. Just like our other tools, that are screening tools. It's designed to have a high false positive rate. And that is essentially why the follow-up was developed, in order to kind of tease through those kids who may have been elevated based off of those initial parent ratings, but further follow-up and explanation built into the follow-up questions can help clarify whether or not this is a true concern, or maybe not. But important about this is that even sometimes the follow-up questions will identify kids that may not be diagnosed with ASD, but there still could then be at high risk for other developmental delays or disorders. So we might be looking at an intellectual disability. We might be looking at a child who has a more unique genetic disorder. It will just try to capture some things. And so this will help you tease apart autism from other things. And really what I want to focus on here is the unique scoring of the first kind of run through of the 20 questions that is the MCHAT. So it's very quick. It's just yes, no. But from a scoring standpoint, it's a little tricky. I kind of wish it wasn't like this, because it would have been much easier if there weren't these 3 items that were reverse scored. So this is just something to note, is these things can be scored incorrectly if you're not sort of acutely aware of which ones it would actually be reversed for. So most of the no responses would get a 1 for them, and you're kind of, every time you're adding each item that says no, for the most part, you're adding a number up to help you figure out your overall total score that would indicate a level of risk for autism, except for items 2, 5, and 12. And so for those, if they happen to put yes, that is going to be the one that you're actually going to give a 1 point for that. So those are things that you don't necessarily want to see a kid doing. So if it's a no, but they are doing this behavior, this might be a behavior that is indicative of autism. So one thing that you could just do for yourself, if you look at these, is make sure you run through and you highlight 2, 5, and 12, just to remind yourself visually. Circle all your no's, and then circle the yeses that are on those lines, and then add those. Just to quickly do that. Just something to think about. And then the scoring, kind of keeping those highlighted there, 0 to 2 is low risk. Typically no need for further evaluation unless the parents are reporting other concerns. It's not going to catch everybody, so sometimes it's okay to just listen to the parent and just kind of see, has other people mentioned it? It may be something else besides autism, but worthy of some sort of evaluation. Let's jump to the high risk. So the high risk is if we're getting an elevation of total score all the way up from 18 to 20. That is another time where we can just say we don't need to do the follow-up, because at that point, it's pretty clear that there's a risk for autism. So referrals to local school districts, diagnostic evaluations, or if they're younger than 3, their early childhood intervention programs. At that point, it's pretty clear that you want to just move them towards that process. The scores that might make you actually administer the follow-up are just in this medium risk. So in reality, the follow-up is only if we hit a score of 3 to 7. And that's because, again, we want to tease apart whether or not this actually is a high risk or it's a low risk. So we're going to kind of tease it apart. The MCHAT follow-up is a lot of full pages. I'm talking like a 8 by 11, 8 by 12 page of these little, they're like decision trees, flowcharts. You do not have to administer all of these. I think that's a big misnomer or myth that some people assume and think, oh my gosh, I don't want to do this whole follow-up. This is going to take me forever. Look how many questions it is. You really only have to do it for the items that were of concern, so that they got a point on them. So if it's an overall medium risk score total, only go back and ask follow-ups for the questions that were elevated. And they have a flow chart. It's designed to give you as clear an example of how to do a follow-up interview. So basically, this one's interesting. I just used it here. This is a tricky one, like climbing on things. And if they don't like climbing, then they just kind of ask you, they give you some examples of what about stairs, chairs, furniture, playground equipment. If they're saying yes, then they're going to pass this. If they're not, then there's a concern here about this child being almost sort of cautious, maybe having some gross motor delays, maybe having some fears of some of that proprioceptive or movement sensations to climb up on things there. But I wanted to walk through a few more just to give you a better idea here. But before I do that, so if 2 or more of the items fail with the follow-up, then that's your indication that this probably is a higher risk child. and you want a further evaluation. But just to give you some more examples to have you feel comfortable to do this, it's pretty scripted. So I like this item as a follow-up. So you reported that you've wondered if your child is deaf. What has caused you to wonder that? It's super important to walk through that, because if the child hasn't had an audiology exam, that would be a very great point of recommendation. It's often something we have to sort of rule out before we even give a diagnosis. It's, are they ignoring people or sounds? If you actually wind up saying no, but there's a different reason they wondered why they were deaf, then you're saying, okay, that's fine. That's probably a pass. There was some other reason they might wind up explaining why you thought they were deaf. And if they're saying yes to either of those, then that's a fail. And then you really want to go to, has your child's hearing been checked? That's a pretty straightforward one there. That certainly tells us we need to go get some medical workup. Just kind of tease through that. A less straightforward one, I think, is this item asking about pretend play or make-believe play, because those terms in themselves may be difficult for parents to know exactly what that means. So I think this is great that there's so many examples here that you could ask about to help you know here. So it could be pretend food, stirring imaginary things. It's hard to know how a parent might interpret this. So I like this follow-up question a lot. To walk through that might reassure them, oh yeah, that actually is pretend play if they're doing those sorts of things. Or if you go through a lot of these and they're really like, no, that's not what they're doing. We're not seeing a lot of that. They just like to stack things. They like to crash things. They like to look at spinning things. Those might be some of the opposite answers for this, and that will help you tease apart pass or fail. These two I put together because it's sort of they're a little related. This is talking about unusual finger movements near their eyes, or none of these. Sorry, the next one is when they're related, but another one where I just perceive parents to have a little bit of difficulty understanding exactly what this means. So these are just kind of wiggling. It helps tease apart looking at your hands, which is developmentally appropriate, or using your hands for peekaboo. Of course, that would be a time they're in their face. So let's just rule out that those are the things, and we're getting more specific about doing things more like close visual inspection, peering, things like that. Interest in other children may be another one that we really want to break down. If they're just shy versus, we can start to tease apart, are they actually interested in other kids, but they're looking at them, but they're not necessarily, or they're talking about them. So all these questions can be great. In the interest of time, I'm going to hop ahead a little bit. You guys can always reference back to these. So I can start to talk about, since some of the questions we've already addressed are related to this, the idea of communicating these concerns. So as I had already mentioned, I really like to rely on scores. I like these tools because it kind of takes the observations off of me. It puts the parents, the caregivers, whoever's filling this in, as the driver of the information, and just kind of says, okay, well, this is your experience. This is what this tool is designed to capture, so we can tell to a degree whether or not this might be concerning for a difference in development or not. And so I think that could be an easier way to start this conversation, rather than saying, oh, I'm just seeing these things and I think this is maybe atypical or this may be concerning. That can be a hard thing to say to a parent, or it can be a hard thing to hear from a parent. But asking permission to maybe have them fill in a rating scale so that you guys can feel that you have a good sense of where their development is, I think is a nice entry point. Of course, emphasizing that screening does not mean diagnosis, as we've emphasized throughout, that this is just intended to capture a child that might need a further workup and maybe actually completely fine. You could recommend then further evaluation, give them those resources where they could go to do that. And then, of course, you can always consider providing reading material. If this is something, you're concerned about, this is what the American Academy of Pediatrics recommends, is that you can give some information so that they can digest it and kind of perhaps go through that journey of, oh yeah, my kid is doing X, Y, or Z, or is not doing X, Y, or Z. And this is helpful to read about and understand what this could be. Let's see. As I've mentioned here, local early intervention providers, I should have added school districts on there for this, or specialized clinics that are local. Lots of providers can do these types of evaluations. It just really depends on what they specialize in. So some psychologists like myself do this, some neurologists do this, and then certainly a lot of the developmental behavioral pediatricians are trained in this sort of evaluation. And wait lists can be long, so encouraging families to just maybe even get on a wait list, and then we'll see when you get there if you even really want to pursue the evaluation. But at least you've gotten them started on a process, perhaps that that they can have that resource once it becomes available. And then lots of additional resources. So the SWYC manual and training resources, there's a lot of wonderful things on their website. There's an actual form and milestones calculator. And let's see, the CDC has a lot of great developmental milestones, some activities families can do based off of those, any delays that they're seeing. Definitely just wanted you guys to have quick access to some of these FAQs. If you want to know about other level 1 screeners and level 2 screening tools for autism specifically, there is a great article out there, the research article I referenced. It's a meta-analysis, so they looked at all the things and kind of give a sense of what's most effective. And then very specific to the MCHAT, there's another instructional video that you could, deep dive into. And then again, just another guide here, which is really, really nice for communicating concerns. It kind of walks you through very specifically examples of what to say to a parent about autism concerns. Whew, we made it.
Awesome. Thank you, Meredith.